And in the meantime, another virus is growing its presence in the Carolinas. Some folks worrying that health officials aren't doing enough to stem the spread. And while the CDC does still classify monkeypox as low risk to most Americans, some groups are concerned the current messaging and response will let this virus infect more than it needs to.
There needs to be more done. There needs to be more education done. There needs to be more strategy.
Jermaine Nakia Lee airing concerns with the public health response to the monkeypox virus. As co-founder of the group Charlotte Black Pride, Lee is aware of the virus's disproportionate impact on MSM, or men who have sex with men. But he's worried that's wrongly getting all the focus.
There are folk who are not concerned about this disease who should be concerned about this disease. And there's going to be a rude awakening when somebody's mother or somebody's father or somebody's child is living with monkeypox.
That's because the virus mainly spreads through touch, close contact, and shared used clothing or linens, meaning transmission can happen during sexual encounters, but also in friendly or familial settings. While public health officials have discussed the possibility of wider impacts, they are prioritizing certain MSM for vaccine.
We've got to be laser focused on trying to avoid widespread community transmission, particularly in areas of high impact. And it's important for that community to be aware that it's disproportionately impacting them. At the same time, that risk spills over to everybody.
Then there's the rallying of resources. Earlier this week, Mecklenburg Public Health said it got more monkeypox vaccine from the state, but had a waiting list for doses, hundreds long. Lee says he's experienced lagging testing, too.
My wait time was about a week.
He worries while response ramps up, the virus is gaining ground and opportunities to get into the community and educate are passing health leaders by.
There are amazing organizations like Charlotte Black Pride that are willing to assist the health department that this doesn't become an epidemic.
And so we can tell you tonight that monkeypox has infected almost 5,000 in the U.S. and spread to nearly every state. North Carolina reporting close to 50 cases tonight, and the latest count in Mecklenburg County, which was given to us earlier this week, stood at roughly 20 cases.